those today who are joining us for FSMA Fridays, welcome. Thank you for joining our March session. Today is going to be a good session. Lots to talk about. My name is Jill Bender with Safety Chain, and we'll go ahead and get started. Just a few quick notes as we get going here. For privacy reasons, you'll only see yourself on the WebEx platform if you're logged in. But as always, I see lots of people streaming in to join our discussion. That's great. We will certainly be sending out the recording link early next week, Monday or Tuesday, for those that are interested in re-listening to this session or passing on to a colleague. And as always, if you are having challenges hearing it on the audio portion, if you're listening to your computer speakers, I always recommend calling into the conference number provided. So with that, I'm going to go ahead and get us started here. Delighted, as always, to have with the Acheson Group. Dr. David Acheson's on the call with us today. Good morning, David.
Good morning, Jill.
And also we have Rolando joining us again. Gonzalez also with the tag team. Good morning, Rolando.
Good morning, Jill. Good morning to the audience.
So we will go ahead and get started. Why don't we share, David, what is the latest that's happened the last few weeks with FSMA?
Yeah, absolutely, Jill. Well, there's a few things that have changed a little bit, or a few things have moved around. I'll just summarize a brief list that I've got and give everybody some thoughts on this. I think probably one of the biggest questions is Mike Taylor, who's been heading this program up, has now announced that he's leaving the Food and Drug Administration and going off to do something different. So big question, will that make a difference? Is that going to change timelines? Is that going to change anything? And my response to that is no, I don't think so. I think Mike deserves a lot of kudos for having driven the regulations through and got us to this point. The person who's taken over from him, Dr. Steve Ostroff, is now in charge of what I think is probably the hardest part of this, which is driving it through to execution and truly implementing the changes. So I think we'll see some changes. And of course, remember it's an election year, and it's like, how could we forget? And that also slows everything down. Second point, guidance documents, we're still waiting for those. A lot of companies are just, we're all having to move forward without the guidance documents and interpret as best we can. I've not heard anything about when they're coming out, but we can keep hoping that it'll be soon. Another FSMA update is that we've got more money going into different components of FSMA, and I'll just make one comment on that, is that the FDA's announced they're putting, I think it was some $25 million into training focused on produce, and then announced that is largely being focused on training the states on how to interpret the produce rule and inspect farms in relation to that. So kind of what we've been saying all along is that the inspections on the farms are probably going to be occurring by FDA-trained state officials as opposed to FDA inspectors themselves, which is exactly what we thought would happen, and it makes good sense. So we've got a little funding going in, not a lot, but a little. The guidance documents, the leadership changing, and I think one final point is that obviously there's a lot of training programs now in place for coming out for the PCQIs, Preventive Control Qualified Individuals. So there's lots of those coming online, which is good. And just a little plug for TAG is that my colleague on the call with me, Rolando, is a trained trainer, as is other people in TAG. So we can offer that also if anybody's interested. And final point is we're still expecting training programs like the PCQI to be coming out on the produce. And also, I think ultimately on Foreign Supplier Verification program, but don't have timing on that one. So quite a few things going on, Jill, in terms of FSMA updates, all those little relevant factors of how it's all impacting the way we're seeing this. So a bit more than usual on that one.
Okay, great. My guess is that's going to continue to sort of snowball as we get closer to deadlines here, correct?
Yes. Well, one would hope.
Yes.
But given that we're almost in April, and and companies that are more than 500 people have got to be compliant by mid-September. It doesn't give us very long to be reading the guidance documents and making a bunch of changes. One would have hoped that these would come out a bit earlier. And so we're having to kind of just fly by interpreting the rules as opposed to being able to use the guidance documents. But yeah, let's hope that they're going to appear soon. Actually, one other point I should just make in terms of updates is the sanitary transport rule. I forgot all about that. That's due to pop out at the end of this month, and I've not heard that it's been delayed or any problems with it. So I think we can anticipate seeing that one pretty soon too. So I forgot that update. That's an important one.
Well, and I think, well, we've talked about this before. We had that scheduled for next FSMA Fridays, assuming it comes out. So your team will have a few weeks to be able to review that and provide the high-level insight. So that, you know, is definitely on the charts for next month, excuse me. Great. No, thank you. Well, let's go ahead and then dive into today's topic. And I should mention that for those that joined us this last month previously, we did go through our FSMA readiness survey. The tag team and safety chain had sponsored a survey that was put out there, and about 400 respondees talked about their FSMA readiness strategies and approach and where they're at. And I think the key things that came out of that, as we were discussing the results last FSMA Fridays, were where the areas or gaps that we're still seeing based on that survey. And one area that the Acheson Group identified that we thought would be good to sort of really piece together, and that's this month's discussion, supply chain controls and how the preventive controls for human foods and the foreign supplier verification program fit together. So that is today's discussion. We have a few topics around that, and we'll be taking questions. So I'm going to go ahead and dive into the first one around this topic. And Rolando, I'll shoot this over to you. Can you just talk about why does supply chain control matter?
Absolutely, Jill. Yeah, great question. So, I mean, no question that food safety events in the recent past have generated significant media attention and resulted pretty much in an increased concern over the food supply in general. We can probably all think about examples of issues that have been brought about by suppliers, both domestically and those who provide us food and ingredients from overseas, of course. We've seen product recalls, tougher regulations, new industry standards. No question that they're all impacting the food and beverage supply chains pretty much worldwide. And with a supply chain that is getting increasingly complex and globalized, the situation is definitely not likely to get any easier. So we've seen some of these high-profile cases, food safety outbreaks with substantial economic consequences, lost sales, recalls, compensation costs, damaged reputation, and ultimately putting some of these companies out of business. So by implementing controls within their supply chain, businesses can improve visibility into their upstream sources, and in that way determine whether their system is, and the solutions that they have in place are sufficient to comply with the new rules and regulations, respond to the pretty much ever-evolving consumer habits and demands, and also protect their brands from the potentially damaging impact of a recall, perhaps an outbreak of foodborne illness. So it also helps position companies as responsive and proactive entities in mitigating risk and protecting public health. So it's definitely a good idea. That's why supply chain controls truly matter, and companies should definitely pay attention to that. Back to you, Jill. Jill?
Oh, thank you, Rolando. I appreciate that.
Sure.
You know, I was noticing on the attendee list, and this often happens at FSMA Fridays, is, you know, the mix of attendees today is really from produce, manufacturing, distribution, retail. I see just a really big mix throughout the supply chain. So, you know, your response and insight on this question, I know really was relevant to the audience. Thank you. Going on to the next question that came up, and David, I'll go ahead and put this one over to you. How did FSMA evolve with regard to supply chain regulatory requirements?
Well, I think we have to keep in mind what it is in today's environment, and this gets at building off what Rolando has just talked about. As a food company, wherever you are in the supply chain, whether you are on a farm or a manufacturer or a distributor or food service, retail, one of the most frequent calls, and maybe the most frequent cause, other than labeling issues of allergens, is when you get that phone call from one of your suppliers saying, "We've just realized we've shipped you something that's causing a problem," this is, it's typically just the nature at work because it's hard to keep everything perfect all the time, and so we've seen a number of situations where supply chain controls have caused fairly massive, broad, high-consequence recalls. And we said before that the Peanut Corporation of America example was a big driver to a lot of the regulations that well, at least the statute. Let me be specific. It wasn't the regulations. It was the statutory language that went into FSMA in 2009 and 10, or 8, 9, and 10, as it was being finalized before finally being signed into law early in 2011. And those of you who think back to PCA, that recall, in fact, there were several from a couple of plants, triggered close to 4,000 other recalls of people in the downstream supply chain who'd received this product. And that was massive. The recall started in January and continued through to July. It just kept going on and on and on. And I think this got Congress to say, whoa, we need to make sure that food companies take responsibility from a regulatory perspective of their suppliers. And so it was really because of that and because of other situations where we'd seen recalls that had got pretty broad because there was a failure to control supply chain risk, that this went into the statute. And basically the statute said, okay, FDA, you've got the authority to require supply chain controls. And so, again, those of you who remember back to the first version of the Preventive Control rule, it was actually silent on supply chain control. And we talked about that on FSMA Fridays, and I think we all anticipated it would go in the final rule, and sure enough it did. It's recognition that the FDA is saying to all of us, you need to pay attention to your suppliers. And the way FSMA further evolved on that was that we had, when the original proposed rules came out, as I said, the Preventive Control rule was silent on supply chain, but the Foreign Supplier Verification Program was not. And the Foreign Supplier Verification Program basically said if you're an importer of food, you need to do the due diligence on your suppliers. You need to assess the risks. You need to make sure that the suppliers are controlling those risks, or somebody you're selling the product to is controlling those risks. And there was a big discrepancy between essentially the burden on imported versus domestic between the two rules. And in the final rules, that's all got flushed out. Essentially, the burden is now the same. And if you are importing food, there's requirements on for you to do due diligence on your suppliers, just as much as it is as if you're sourcing the food from the neighboring state or down the street. So FSMA has evolved from essentially recognition that this is an area that needs regulatory oversight, which was what was in the statute, and we've now got regulatory requirements for firms that need to be compliant with the Preventive Control rule, or importers, and those are the two rules I've just been talking about, Preventive Control rule and Foreign Supplier Verification Program, which essentially covers the whole system. It doesn't impact farms, and it doesn't impact retail and food service, but importers and registered firms has got a big focus on supply chain controls and regulatory requirements. And this is a big change. That's very new. That's never been there before. So it has evolved, and where we've landed is not just, as Rolando said, for brand protection. It's now a regulatory requirement to do that and have that program in place. So an interesting evolution, but we've kind of landed at what the statute intended. So that's kind of the thinking on that one, Joe.
Okay, great. Thank you. And I do remember the session. I believe it was a few years ago when we first started FSMA Fridays, where there was that big debate, right? And the all the information that was provided to the FDA about this as a result. So it's interesting. The crystal ball effect worked there, didn't it?
Yeah, it did. Right.
So we'll go ahead and take it to our next topic here. And David, I'm going to ask you to stay with us on this one. What does the preventive control rule require? And just sort of, again, a high level, because I know we've covered this before, certainly.
Are you directing that at me or Rolando?
Oh, no, I have you next to that, but I'll leave that up to you.
Okay. No, that's fine. That's fine. I just want to make sure that I'm tracking with you. Well, I kind of touched on this a little bit. The preventive control for human food, basically for supply chain, is a relatively simple concept, and the details are complex. But then that's always true of these regulations. But let me just try to convey the mission here. First of all, if you need to be compliant with the preventive control rule, then you need to be compliant, for the most part, with the supply chain control part. There's exceptions for warehouses and those types of things, but I'm not going to get into that. And first and foremost, you need to be sourcing from approved suppliers. So you need a list of your suppliers and determine that they are approved. So what does that mean? An approved supplier is what you've got to do is you've got to do an assessment of the risk of whatever it is you are buying from that supplier, whether it's a finished product or a raw ingredient or a partially processed ingredient. You do a hazard assessment, no different from any other hazard assessment. Based on that hazard assessment, you need to be looking for the risks that require a preventive control. Same principle we've been talking about for a long time. If your preventive control qualified individual has done an assessment of an incoming ingredient, you've determined there's a risk that requires a preventive control. The next question is, who is controlling that risk? And is it me that's going to control it, or is it the supplier that's going to control it? If it's me that's going to control it, I'm receiving a raw ingredient, I'm going to cook it, I'm going to control the risk I've identified, then essentially you can check the box and you can say it's okay to receive that ingredient from the supplier without it being processed because I'm going to process it. I've identified Listeria, Salmonella, E. coli as a risk that requires preventive control in that ingredient. I'm going to use it in my cooking step, and I'm going to control that risk. So the supplier is thus approved because you're controlling the risk that you've identified. If, on the other hand, you determine that the supplier is going to control that risk because you're using that ingredient in your finished product, you're not going to further process it yourself. You're relying on the supplier to control the risk. Say it's a raw nut of some sort, and that supplier is roasting that nut and sending you the roasted nuts or some ground component of the roasted nuts, and you're going to use those as a sprinkle on some final product. You're relying on the supplier to control that. So the next, if that is the case, then you have to say, okay, we've identified, let me stick with the Salmonella example, we've identified Salmonella as a risk that needs to be controlled on this raw nut that I'm going to be using on my finished product. I know my supplier roasts those nuts. So I need to determine that risk, in this case Salmonella, is it a risk that if I don't control it would lead to a serious adverse health consequence or death? And with Salmonella, the answer would be yes, it does. So the way the regulation is written is that if you said an ingredient got a risk that requires a preventive control, if I don't control that risk, will I get a Class 1 recall out of it? And the answer is yes. Then basically the regulation says you need an on-site audit of that supplier. And that on-site audit could be done by a third party or it can be done by you, just so long as you've got record that that on-site audit has happened and that the risk is being controlled and that the supplier is compliant with the regulatory requirements that they fall under, which will probably be the preventive control rule. If when you've done your assessment of that supplier and you said, yeah, there's a risk we want to control, say it's low levels of heavy metals, and you know that, if it deviates a little beyond that, it isn't going to lead to a Class 1 recall, but it's a risk that you want to control, then the way I'm interpreting the regulation is that it doesn't require an on-site audit. You can control that risk through a certificate of analysis or a review of their food safety systems to control the heavy metal risk. You don't have to have the on-site audit. You can have the on-site audit if you wish, and that meets the requirements for sure, but it's more than you actually need. So what the preventive control rule is basically saying is look at all your suppliers, all your ingredients, do a risk analysis on all those incoming things, determine if there is a risk that requires a preventive control, number one. Number two, determine who's controlling that risk. Is it you or is it the supplier? If it's you, then it falls into your regular food safety plan. If it's the supplier, ask the next question. Is it a Class 1 risk, in which case it needs an on-site audit? Or is it a Class 2 or 3 risk, in which case a COA is perfectly acceptable? So that's conceptually how I see this working, Jill, is sort of for the preventive control rule. And it delves in the details because there's a lot of data that you need to keep and you need to follow up on corrective actions. But in principle, that's what the human food rule requires for compliance. That's subpart G in the human rule. And just while I'm on it, animal rule is no different. It's essentially the principles are identical between the human and the animal rule. So that's hopefully somewhat of a simple explanation. None of this is simple, but hopefully people have, the audience have tracked with where I was trying to go with that. So back to you, Joe.
No, thank you, David. Absolutely. I was visualizing a more simplistic decision tree based on what you just outlined at the very end to help simplify that. So certainly provided visualization for me on that component there. That was great. Let's go ahead and move on to the next topic. I'm going to bring Rolando back into this. Let's go ahead and touch on the Foreign Supplier Verification Program and the requirements.
Sure, Yale. And one thing that I wanted to recall here is that like David was saying before, I mean, there's been a shift in the approach here. And in the case of foreign suppliers, FDA has pretty much moved from relying specifically or exclusively on inspections at the port of entry and shifting that responsibility pretty much to the importer and the receiving facilities. And also I wanted to point out that what they're looking for here is that foreign suppliers, or to ensure that they're producing food in a manner that provides the same level of public health protection as of companies that are manufacturing food here in the U.S. and are subjected to either or the Preventive Controls rule or the produce safety regulation. So in terms of requirements, very similar to what David was mentioning under the Preventive Controls rule, with a few additional details. For example, one of the things that are required on the FSVP is that there should be a compliance status review of the food and the suppliers. And that can be done by looking to see if there's any import alerts, for example, against a particular supplier. If there's any FDA warning letters, any recall notices, so any of those resources that can be consulted to ensure that they are performing well. Of course, you can also use internal data such as responsiveness, attention to any requests that you as the importer or receiving facility have placed over them. So that's all part of monitoring that performance. There has to be the hazard analysis that David mentioned. One thing to add to that is that it should consider the potential for economically motivated adulteration as one of the hazards. So that applies under FSVP as well. Supplier verification activities are exactly as David mentioned. That includes the SACOTA hazards and the need for an on-site audit in that case. There have to be corrective actions if they're needed. That should be defined as well. There's a requirement for a periodic reassessment of the FSVP. That's at a minimum every 3 years that it needs to happen. There are going to be, of course, certain situations that will trigger a more frequent reanalysis of the plan, but that is a minimum that the FDA requires. There is also importer identification at the port of entry that needs to happen. And for that, there is the DUNS, the DUNS number that needs to be obtained for each one of those suppliers. And there's also record keeping, of course, like any other element under FSMA. So the number of requirements, again, very similar to the Preventive Controls rule and the supplier controls under that, but making sure that we understand that there is a few nuances, a few differences that apply under FSVP, that are not necessarily present under Preventive Controls rule for human or animal food. Back to you, Jill.
Okay, great. And that was a lot of data. We often summarize FSMA Fridays in blog posts, and I was just making a note of that. I think a lot of the pieces you just went through will for sure include in our summary as a post recap for the session. Thank you for that.
Great.
Let's go ahead and move to, I think it looks like our last topic around this session today. And David, I'll ask you come back to this one. We just talk again about who has to comply with which rule.
Yeah, big source of confusion here, Jill. And just to clarify what this question is about is do I have to comply with the Preventive Control rule, supply chain requirements, or with the Foreign Supplier Verification Program requirements? And that's caused a ton of confusion for people. Let me try to sort of boil this down. Is that FDA's approach to this is saying we want the supply chain controlled by basically across the board, both domestic and imported by somebody. And we recognize that different parts of it may be controlled by different people. So first and foremost is if you are a company who has to be compliant with the Preventive Control rule, which means that you are registered with FDA as a manufacturer, processor, packer, or holder of food, and that you're not exempt because you are under juice HACCP or seafood HACCP, for example. There's obviously more exemptions, but those are the big ones. So you're not exempt, and you're not a warehouse or some of the other minor exemptions. Then you're going to have to be compliant with the Preventive Control rule for sure, which includes the whole supply chain piece that I was talking about a few minutes ago. So if you fall under that, you're going to have to be to be compliant with the Preventive Control rule. You're going to have the supply chain control piece, use of approved suppliers, built in as part of your overall food safety plan that FDA can come and look at if they drop in for a routine inspection. If you are an importer of food and you are a company that does not manufacture, process, pack, or hold, you are not subject to the Preventive Control rule, but you are an importer of food, and there's lots of companies out there that do that. They bring the food in, and they know who they're going to sell it to, and it kind of moves down that line. Then if you are the importer and you are the consignee or the recipient of food, you have the financial interest for getting the food into the United States, then you need to be compliant with the Foreign Supplier Verification Program, which, as Rolando has said, is sort of mirrored very much on the Preventive Control rule in terms of assessing the risks and building the program and the corrective actions and all those various bits and pieces. So I realize that some of this is going to overlap. You may be, that same food may be being checked out by through the Preventive Control rule that touches on the importer. And the importer is also doing some similar things with that food. But if the system's working correctly, then it'll all help facilitate control of risks and making sure that food that is coming into the U.S. has met regulatory requirements, and that as for domestic suppliers too. But big focus on import here, obviously, in the Foreign Supplier Verification Program. So in simple terms, if you're an importer of food, then it's Foreign Supplier Verification Program. If you're a registered firm manufacturing, processing, packing, or holding, unless you're exempt, then you're going to be doing all of this under your supply chain control program. And if you are an establishment that needs to be compliant with the Preventive Control rule, and you also are an importer, then you're entirely covered with what you've done under the Preventive Control rule. And one of the exemptions in the Foreign Supplier Verification Program is if you are an importer who also has to be compliant with the Preventive Control rule, then that basically satisfies all the requirements for the Foreign Supplier Verification Program, and you don't need to worry about it. So I think that's the divide, is if I need to be compliant with the PC rule, do Subpart G, which is the Supply Chain Control Program on the human side. If you're an importer and you don't need to be compliant with the PC rule, then you will need to be compliant with the Foreign Supplier Verification Program. So it's none of this is simple. And, you know, we've written about it in our newsletters, and we'll continue to do so. And I think it's going to continue to come up. But hopefully that's added at least some level of clarity to the increasingly thickening mud around FSMA and how we all interpret it. So back to you, Jill.
Thank you. And I think that clarification, it was a bit of a light bulb for me. And I know you've discussed it in the past, but that the concept of if it's Preventive Controls and FSVP, you're covered. So I think that was an important distinction. Thank you for that. With that was our last pre-submitted question. A few questions have come in today. I'd like to take a few minutes here to try to address those, and then whatever we don't get to, we'll try to roll into next session. So again, we'll just take a few minutes. I'm going to throw a few questions at the tag team, and then we'll wrap up today's session. One of the first questions I thought was something important to bring up sorry, I'm just looking at all the different ones that are starting to fly in here. Kelly is asking, how do you document if a supplier doesn't have to comply with the PC rule, but you still have to comply? And then I'm not sure if that makes sense. Now that I'm reading through it, maybe you can interpret that one, David or Rolando.
So let me give that a shot. So we have a supplier who doesn't need to comply with the PC rule, and you're using goods out of that supplier. What do you have to do about it? I think that's how I'm hearing the question. So Kelly, if I've got it all wrong, shoot me an email and I'll try and get it right. But you know, let me work off that. It really doesn't matter that the state of your supplier. FDA is, the way I read the regulation, FDA is expecting you to have assessed the risks in those ingredients, irrespective of where you get them from, and assess those risks and determine, is there a risk that requires a preventive control, and if so, who's executing on that control? Is it you or is it the supplier? And if it's the supplier, then basically the FDA is saying, you know, you need to have some assurance that the supplier is indeed controlling that risk. And as I said, depending on the level of risk, that might need an on-site audit, and to make sure that they're compliant with applicable FDA rules and regulations. They may not be compliant. They may not need to be compliant with the preventive control rule, but you've still got to make sure that that risk is being controlled. So it frankly doesn't change anything. For you to deem that an approved supplier, you need to have done the risk assessment and figure out who's controlling the risk. If there's one that you've decided needs a preventive control, is it you or is it them, in simple terms. So hopefully I've answered the right question there, Jill, and if not, I say, Kelly, just shoot me an email and I'll try and be more articulate.
Actually, she did reply that, yes, you absolutely got the gist of what she was asking, so that is great. I do have to, I'm going to go ahead and just pick a few more questions here, and again, we'll capture what we weren't able to answer, and perhaps we can have like a quick fire Q&A session next FSMA Fridays. One question that did come in was, can the importer of record request access to their supplier's food safety plans?
Rolando, do you want to do that one, or I give that a shot?
David, if you want to tackle that one, yeah, that'll be great.
I thought that was it. I thought that was a good one.
All right. Okay.
Yeah.
Okay. You know, it's sort of like what's the regulatory expectation, and I think that the importer of record. First of all, there's confusing terminology there. And the importer of record is terminology that goes back to the Bioterrorism Act. And you know, this is this person who is responsible for the prior notice, and as part of meeting the requirements for the Bioterrorism Act. That's the importer of record. And that's all dealing with Customs and Border Protection and FDA and registration numbers and prior notice. The importer of record may not actually be the individual who is responsible for ensuring that that food has met the Foreign Supplier Verification Program requirements. So that's the first point of clarification. But let's sort of say that we're focused on the person. We've got an importer who's got to meet the Foreign Supplier Verification Program requirements, and their regulatory obligation is to assess the risk in the ingredient, determine if there's a risk that requires a preventive control, and if there is, who's controlling that risk. And if they through that process, and they need a qualified individual to do that. I recognize that, and the FDA has said that. You need a qualified individual to do that. If that qualified individual has said, all right, that foreign supplier needs to be controlling that risk. It's a spice. We're worried about salmonella. They're undertaking steam pasteurization or gas treatment or something, or irradiating it, whatever they're doing. They're controlling the risk. That importer is expected to get enough information to be able to say, yeah, I've got confidence that that supplier is controlling that risk. And you know, in that example of controlling salmonella in a spice through steam pasteurization, that requires an on-site audit. And if the foreign supplier refuses to give you the on-site audit or refuses to give you the information, frankly, you're in violation of that. But I would also say that that foreign supplier, in order to import food into the United States, has to be, from a regulatory perspective, has to be compliant also with the preventive control rule in the example that I've used. They're processing a spice. They are directly importing that spice into the U.S. They're a foreign registered facility, or because if they're not, they couldn't import the product. That makes them a facility that has to be compliant with the preventive control rule. So they've got to do this stuff, and if they're not compliant with the preventive control rule, and you know, frankly, they are an illegal exporter because they're out of compliance with regulatory requirements. And if I'm looking at this from a purely regulatory perspective, putting business complications out on the side, then you shouldn't be using them, because you are regulatorily out of compliance, and so are they, and it creates a vulnerability for you as an importer. So, you know, how do you get around this? I think first and foremost, you've got to go educate your suppliers and say, look, you may not want to send me this stuff, but you need to realize that if you want to continue to import into the United States, you're going to have to pay attention to these rules, because if you don't, the FDA is going to find out, and you'll be on an import alert, and you won't be importing anything. So it shouldn't be as difficult as them saying, well, I'm not going to send you that stuff. And what that tells me is that foreign supplier does not yet get it. They don't understand that they also have to pay attention to these rules if they want to continue to send their spices, to use my example, into the United States. So that's an educational process is kind of where I'd start, in a gentle, nice kind of a way, before you get the stick out and say, well, I'm not going to buy from you if you don't get your act together. But that's your ultimate resort. But that's David with his regulatory hat on. It's not me with my business hat on, because that's where it gets complex. And, you know, the whole business infrastructure and supply chain management starts to crumble and erode when some of these regulatory requirements stomp all over them and say, well, you're not understanding business practices. But you know, that's one of the challenges when you're trying to interpret regulations. They don't always pay attention to current business practice. Hopefully I've answered the question, Jill, or at least given some food for thought.
Well, I think it actually addressed a few questions that were coming in, so thank you. That's good. And with that, you know, a lot of questions did come in, as I mentioned. We capture these. Perhaps we might be able to extend next, I'll have to look at calendars next FSMA Fridays and get to more of these questions next time, but I do just have a couple wrap-up things here. I think, you know, as David had mentioned, lots of clarity still needed, interpretation, and certainly TAG is available for that. So these monthly sessions are designed to keep at a very high level informative approach, but again, if you have specific questions or need consultation, the TAG team that's what they do. Then of course I would be remiss if I didn't also plug Safety Chain and our food safety and quality platform or mobile apps, the preventive proactive approach to managing your food safety and quality operations. Also, I did mention earlier, thank you for everyone that filled out the FSMA Readiness Survey. The report is in its final stages, and that will be emailed out, a link to that to everyone that's part of FSMA Fridays sessions. A good few thousand folks will be receiving that early next week. And then sort of a wrap-up today's session next month in April, assuming that the sanitary transportation rule does come out. There'll be some insights and interpretation from the TAG team on that, and then as well as a good few other topics coming up as well. And as always, we'll send out the recording. We have a couple of webinars, one here at the top of the hour on mobile technology with a couple of Safety Chain customers. I see a few folks look like we're going to be jumping onto that. And I know both the Acheson Group and Safety Chain alike do attend quite a few conferences. There is one DFA Food Safety Conference coming up in Monterey next month. I know the TAG team will be at. Food Safety Summit is always well attended, as well as a BRC conference. And of course, you can always find us online. So with that, I'm going to go ahead and wrap up the March session. Lots of discussion, great points here. Thank you so much both to David and Rolando, as always, for providing your insights. And I think we will go ahead and wrap up. So happy FSMA Fridays to everyone, and thank you so much.
Thanks, everybody. Appreciate it. Thank you, Joe.